Hi, I'm Dr. Jon Mendelsohn with Advanced Cosmetic Surgery and Laser Center. In today's world and with today's ever-growing technology, we all know a picture can be taken anywhere at any time and shared in an instant. We also know that our patients live active lives and we want you to always look your best. So stay tuned as we bring you our series called True Selfies.
I just went to Las Vegas and posted 1 million photos on Facebook, and I didn't edit a single one, didn't Photoshop them, didn't do anything to them, which is amazing because I feel like my skin is so tight and smooth and the wrinkles are gone. There was a blizzard the day of my surgery. It snowed about a foot the night before, and that morning the roads were a mess. So I was afraid I wasn't going to get there on time, but thank goodness my husband was driving. So I remember that part vividly. It was very icy. The car was skidding a few times on the way to the surgery, which added a little bit to my anxiety. Then I remember arriving in the office, and I was in my comfy yoga pants and a jogging shirt, and I was very tired. And I remember I was literally laying on the couch in the waiting room with my head in my husband's lap, trying to rest a little bit when they came out to get me. And they walked me back, and I was excited that my husband got to go back with me before the surgery because I didn't know if he'd be able to accompany me. And they gave me some very good drugs, which I literally felt right away because I'm not used to taking any relaxing type medications. And I remember right away, like within 2 minutes, I was like, ooh, I feel this, I feel okay. And I couldn't care less what they did to me at that point. So it calmed me down right away.
Where she is.
Hello there.
Oh,
Dateline NBC.
Looks like the drugs got the best of you here. We're going to have you sit up there.
It does. Good, look at that look.
Oh, you look like you're feeling good.
Okay.
And we're going to come back here, Julie.
Lying on the OR table, I was great because I had made my favorite Happy Tunes mix on my iPod. So Dr. Mendelsohn had already hooked it up and was playing my favorite Happy Tunes. I made an hour's worth of music just in case. The worst part of the whole prep was, as he warned me about injecting my face with the lidocaine and whatever else they put, epi, I was actually so comfortable that I was like tapping my feet to the music.
Yeah, so this is kind of what we're doing here. Is just raising the flap. Julie, you good?
I need water as soon as I get up.
We're going to get you some water. We're going to get a little dressing on here. And you've got a very nice result here. Be ready for your friends in San Francisco here.
Yeah. I don't remember a whole lot about the recovery room. I just remember that I had this bandage wrapped around my head like a mummy, and they took my blood pressure, and that's kind of a vague memory for me. It seems that they sent me on my way pretty quickly. I know they took my blood pressure, and they talked to me about some instructions, which my husband read, and I don't really remember, because I was pretty woozy. It just seems like I was out, I was out in 5 minutes after I got up, went into recovery, they handed some instructions. I'm sure it was much longer than that, but to me it seems like 5 minutes and I was out the door. And I think it was actually noon, but to me it seemed like I was only in there an hour.
So Julie just underwent her facelifting surgery, her advanced facelifting surgery, and to my delight, she actually had results with a better outcome than I anticipated. Some of the challenges with Julie were her anatomy and some of the loss of elasticity in her neck skin.
But we were able to support the SMAS very well, and I think she's going to have a beautiful looking jawline. We've gotten rid of her jowl and we've improved her neck. I think Julie will be very pleased with the results, and I think she'll be ready to get back on camera soon.
I don't remember the first day almost at all. I slept very comfortably. I took some of the pain medicine and some Tylenol, slept with my head propped up, but I slept really soundly. I think I sucked down some broth through a straw. I didn't really eat that much. And then all of a sudden it was the next morning and time for me to come in and have the dressings removed. So that first day is really a blur.
That night?
No, I slept like a baby, and I didn't think I would be able to sleep on my back because I'm not a back sleeper, but I was good. I did what I was supposed to. I slept with 3 pillows underneath my head practically all the way up because I knew it would help with swelling and everything. And then my husband had to fly. He's a pilot. He flew that next morning early. So actually, my mom came up to my house. No, she didn't because it snowed. Dr. Mendelsohn sent a driver to my house who got my mom and me and brought me to the office the next day because of the snow and because I'm not supposed to drive, and my mom would not, she's 80, she would not drive in the snow, to the office the next day so that I could get the dressings off. It was a nice touch to send a driver, it really was. That was amazing. I expected to go in and have them take the bandages off and show me in the mirror, and I expected to look like a wounded warrior.
So Julie came in today, post-operative day 1. We performed her surgery yesterday. We unveiled her, we took her dressing off, and she began to cry. She was very thrilled with how her jawline, her jowl, and her neck were all significantly improved. As I mentioned yesterday, we thought that we were able to achieve a better result than we had anticipated, and I think we set the expectations lower with Julie, and I think we achieved more. I think she should have an excellent outcome, and I think she'll be able to achieve her goal of getting back on camera.
Oh. Oh. Love it. No, I just can't believe it. It's just better than I ever in a million years dreamed it would be. Everyone probably says that walking out here.
They both look great. And what I was trying to explain is this is the typical patient, 54, she's starting to see some changes, and this is a perfect technique for her. So.
Oh, I just can't believe it. I had no idea. I thought I was going to be black and blue and bloody. I mean, I was prepared for the worst, like I'm going to have to hide out now. I did not have a single bruise except for one of his injection marks on my neck. I literally looked amazing. I cried and cried and cried in the mirror when I saw what I looked like. I just couldn't believe it. My hair was in disarray. My face looked great. I mean, I took pictures of myself and I just couldn't believe it. I could not believe that I had a chin again and that my neck was already smooth. And the liposuction that he did, there was hardly anything there. There was just a bandage. I couldn't believe there was no mark hardly at all from that. So it was 100% better than I ever expected it to be the day after. That blew me away. My mom walked in after I got a chance to see myself. She walked into the room and said to Dr. Mendelsohn, "What have you done with my daughter?" So she was the one who was skeptical and didn't think that I needed it. My husband didn't really think I needed it either, but I think she saw the dramatic difference right away. So she was pleasantly pleased as well. I think she may be considering a little plastic surgery now too. We'll see. So, she was amazed. I didn't have any pain. The instructions the day after were much clearer than in post-op because, like I said, in post-op I was a little foggy, and so my husband was the one listening to what I was supposed to do about sleeping with my head propped up and everything. But the next day, since I was very conscious, the instructions were really clear. Yeah, they sent me home with the vasopressin and the swabs and told me to use the hydrogen peroxide. I knew exactly what to do. Before the suture removal, I had, I'd say day 3 or 4 was probably my rough day where I was really feeling red and swollen, and my cheeks were chipmunky. So I would text Dr. Mendelsohn pictures and he would tell me that it's all very normal. And what he actually did is he called in a Medrol dose pack for me to help the swelling go down a little faster. But I kept the staff posted every step of the way on what was going on. I'm trying to think, there were some other issues. Any question that I had, though, ended up being totally normal. The same questions that any other patient would ask or wonder about, and nothing turned out to be anything significant. But I think the swelling in the cheeks and that chipmunky, really tight and red feeling was my biggest concern. And the Mandrel dose pack did help a lot. I actually, let's see, my surgery was on a Tuesday. By Friday or Saturday, I was out walking my dog. Now, I mean, I didn't look great, but I kept the chin strap on, and since it was winter, I had my hood on and my big sunglasses on too to protect my face. And I was out and about in the neighborhood walking my dog. So I'd say, you know, I looked worse to myself probably than I looked to other people. I don't know if they would notice it as much as I did. Oh, right away. I remember the day of my surgery, even though I was bandaged up like a mummy around my head, Karen Lynch told me, "Oh my gosh, your chin looks great," because all you could really see was my chin sticking out and how it was oval again. So even one of the people in the office commented on how, and I noticed that too, that like my chin is chiseled and little again and not this big old square thing. So I was really excited about that. The day I had my sutures out is my first like big reveal in public, because as soon as I had my sutures out, my mom came with me. We went to lunch at First Watch. I was still having a little difficulty chewing at that point because it was only day 6. But I felt great. I felt like I looked great. So I'd say the day I had my sutures out was when I saw the amazing transformation. I wasn't hiding anymore. I was out in public. You couldn't even see the incisions if I wore my hair down and a little in front of my ears. The swelling was down. I walked in the office, everyone in Dr. Mendelsohn's office said, "Wow, you look great." So I think that's probably when I noticed the big change, day 6 or so. Jamie took my sutures out, and she did a great job. It probably only took like 10 or 15 minutes, but it was no big deal. I didn't know what to expect because my ears were still a little bit sensitive at that point. But it was no big deal. She did a great job. I don't think I had a lot of questions at that point, but I didn't have any problems after that. And within 2 or 3 weeks, you can't even see him. He did such a good job. I wear my hair tucked back behind my ears now, and you can't even see him at all. Well, I'm blessed and fortunate because I have my own company and I work at home. So much to Dr. Mendelsohn and his staff's dismay and amazement, I was sending emails and working a little bit, I think, the first day. So it didn't really affect my work mode at all because I just wore my chin strap as much as possible like they told me to, stayed in the house, worked from home, didn't have any client meetings. But, you know, I was going out to lunch and dinner with my husband and my mom the day I had the sutures out. I think I've noticed more than other people have. Of course I haven't told that many people I had a facelift except for my closest friends, many of whom have also had facelifts. So they've told me how great I look, but I think that I'm the one that notices it the most, and it's made me feel young again and more confident. I actually went out and bought some new clothes. I feel like I hardly have to wear any makeup. I feel like my skin looks young again. I feel like I look as young as my husband, who's 6 years younger. I don't know. I just went to Las Vegas and posted 1 million photos on Facebook, and I didn't edit a single one, didn't Photoshop them, didn't do anything to them, which is amazing because I feel like my skin is so tight and smooth and the wrinkles are gone. So, but no one's really come out and said to me, "Did you have a facelift?" I don't think anyone would ever have the nerve to ask that. But the hardest part for me was not working out, and especially doing crunches and a lot of ab work for a while. So when I went back to the gym, everyone asked where I've been when I went back to my classes, and no one really said anything to me, which I think is good actually because it's so subtle. It's not obvious, I guess is what I'm trying to say. I just look refreshed and young, but no one's really said, "Did you do anything?" Someone actually did ask me if I had my teeth whitened. That's so funny. "Did you have your teeth whitened?" No, I didn't, but thanks. So people are maybe thinking something looks a little different, but they don't know what. I feel great because it doesn't take me that long. I don't have to apply a ton of makeup. I wash my face, I throw on moisturizer, a little bronzer. I'm out the door. My confidence is back. I'm not trying to hide from anyone. I'm just not worried about how I look. I mean, even with no makeup on when I get up in the morning, I feel like I look pretty darn good now. And I think my husband does too. He was one of the ones that didn't really think I needed it, but now that I had it done, I think he does realize how good I look. I think he really realizes it was needed. Oh yes, I'm so happy that I did this. And I remember, I think it was Karen Lynch, came in when I left the OR the day of my surgery and said, how was it? And I said, I would do it again. Because it was that easy, like right away, coming out of the OR, I would say, I would do it again. I mean, I was singing, dancing, asking Dr. Mendelsohn questions. And when he was pulling the smaz layer back of my skin, it felt really cool. All I could feel was like a little gentle stretching. And I said, oh, pull it extra tight. And I was just so excited about what he was doing. And who would think that someone like me who hates blood and hates surgery would be so fascinated about the whole thing and asking all these questions. So I would do it again in a heartbeat. If anyone has any reservations, don't get general anesthesia. It's just going to add cost to your bill. You don't need it. Do it under local. You won't feel nauseous. The recovery's easy. You'll take a couple pain pills the first few days. I think the most difficult things for me during the recovery were not being able to work out. It was very frustrating because I had to keep asking Dr. Mendelsohn, can I do this? Can I do this? And he didn't want me jerking around my neck a lot, or especially moving it from side to side. So he banned me from TRX and Pilates. So I had to find creative ways of working my abs, which I did. So that really bothered me a lot because if I don't work out, I'm not happy. So that was the hard part. I guess just giving me my youth back. I feel young. I'm not gonna be afraid to go to my class reunion or go anywhere because I look and feel young and my face matches my body. I kept saying my face doesn't match my little petite body and now it does. I feel like everything's tight and pulled upward as much as it can be. And I don't know, I'm just really confident. I think the next step for me will be, I have some fine lines on my chin and my upper lip area that I want removed. So I'm going to look into having the dot laser treatment to get rid of that. And I might consider having a lower bleph in a few years. I had an upper bleph about 7 or 8 years ago, which still looks amazing. I have nice eyelids. I know my husband, now that I've had this done, he's also considering an upper and a lower bleph. So he will probably be getting that done as well. I would do this again. Dr. Mendelsohn says 10 to 12 years, who knows how long, you know, the maximum results will last, but I wouldn't hesitate to have a tune-up again in 12 years or so if I need it. Tune-up. Now that I know it's a piece of cake, I know what to expect this time, so. CNN recently did a story on me and the charity endeavor that I was involved in. They picked up the story and ran it on CNN New Day, and that was a couple weeks ago, and it was the old footage of me from last winter with my sagging jawlines talking on a local TV station, and I cringed when I watched it. I was grateful that the charity had gotten the national exposure, but I looked at myself and said, oh, that's the old me. I look so terrible. I wish I had new footage. So come August of this year, my partners and I will begin planning this charity endeavor again for our community. And I will eagerly volunteer to be on camera. I won't hesitate. I'll be on every news show they want me to be on. I won't worry about it. And if I send it into CNN, I'll look much better this time around. But no, I'll have no qualms about it. A couple times last fall, I found myself pushing other people in front of the camera and trying to back aside because I really just didn't want to see myself, especially in the harsh natural lighting. When some of the stations interviewed me in the daylight, I looked exceptionally bad. So I won't worry about that next time. All that really matters is how I feel about myself. No one can tell you, you don't need a facelift, you should, you shouldn't, something will go wrong, something could go wrong. You're the only one that knows how you feel about yourself and your appearance. And I had to do this for me. It didn't matter if my husband wanted me to do it or my mother or my best friend. I knew what I had to do to feel better about myself. And these TV appearances were the ultimate catalyst where I realized how bad I looked and how droopy my skin was. So It is toned and perfect now. I wear minimal makeup and I love it. I could not be more thrilled. The procedure is a piece of cake. I would do it again in a heartbeat. I highly recommend it. I always feel young. I feel younger than I am. Like, I had lunch with a high school friend the other day and I said, boy, I feel like we're 18 again. We just pick up. We haven't seen each other in 5 years. We just pick up where we left off. So I've always still felt young. Like, I just graduated from high school yesterday. How did I get to be this age? How did I get to be 50? So I've always felt young, and I felt like my body looked as young and tight as possible for my age. But I'd see my face and I'd see these hanging jowls, and it just didn't match my voice or my appearance or anything else. And I just struggled with that for so long as I saw pictures of myself on Facebook and deleted them, and my skin was just droopy. And there's nothing you can do about gravity. I mean, gravity was just starting to take its toll on my face. No matter how hard you work out, you can't, work out your face and get rid of the drooping on its own. So I needed help, I needed intervention. And now I'm confident, I feel youthful again. I can't wait for my class reunion. I said I wasn't gonna be on the committee again because I've done it every year, but I suppose I will. It's because I look so good. Anyway, I'm thrilled. I just went to Las Vegas and posted 1 million photos on Facebook, and I didn't edit a single one, didn't Photoshop them, didn't do anything to them, which is amazing because I feel like my skin is so tight and smooth and the wrinkles are gone. So